Turning now to your community focus. If you suffer from allergies, you may be feeling like this allergy season has been pretty bad. And allergies can also trigger asthma. Joining us live via Zoom to talk about a local program designed to help kids with asthma is Dr. Barbara Jandasek with Lifespan. Barbara, thanks so much for being here.
Thank you so much for having me.
So you are the Director of Education for Hasbro Children's Hospital's community asthma programs called CASE for short. Tell us a little bit about the program and how it all started.
Sure. So CASE stands for Controlling Asthma in Schools Effectively. It's a program that was started in 2010 with funding from the Department of Health. And it's one of our initiatives at the Community Asthma Programs, which is housed in the Department of Pediatrics at Hasbro Children's Hospital. And this program is really wonderful because it helps provide education on best practice guidelines for asthma management, focused specifically on school-based asthma management. And it includes a school staff training as well as direct asthma management education classes for children and caregivers in English and Spanish.
And you go out to local schools to educate kids and their families. Which schools are participating in this program? Are they really all across the state?
So we tend to focus in the Providence and the core cities, and most of the schools within those core cities have participated in CASE over the years.
And how many people have benefited from CASE?
Yeah, I mean, we have reached so many families. Again, this program has been running for a long time, and I'd say with the community asthma programs in general, we've reached thousands of families, fortunately.
And what makes a program like this so needed here in Rhode Island?
Yeah, so asthma is one of the most common chronic childhood conditions, and it really is very disruptive to families in terms of their quality of life. #1 cause of school absences. It's responsible for around 10 million lost school days a year. And here in Rhode Island, our prevalence rates of asthma are actually even higher, so consistently around 2% higher than the national average. And then we would say, you know, in the urban areas, this is why we focus on the core cities, our rates are actually higher. And in the districts in which we work, we see asthma prevalence rates closer to 30%. So it's really quite a problem. Healthcare utilization is also high in kids with poorly controlled asthma. And there are ethnic and racial disparities. So in our communities, Black and Hispanic children are most likely to have emergency department visits for asthma and be hospitalized due to asthma. So our team, it's multidisciplinary. Many of our staff are bilingual, and our program really is tailored to the needs of urban families. So we know that our programs make an impact. We see asthma control improve. We see those school absences decline. And we really look forward to continuing to implement CASE in schools that have the highest asthma burden. So we know there's lots of work to do, and we know that programs like ours really can make a difference.
And we have less than about 15 seconds or so, but I know that you guys have an asthma camp coming up for kids soon. Just briefly, what should people know about that?
Yeah, Asthma Camp is another one of our favorite initiatives. It's a day camp that runs in the 3rd week of July. Campers get to participate in the typical summer camp activities, but they also learn about asthma management. And this camp is completely philanthropy funded, so it is at no cost to families. We have applications rolling in, and they're due at the end of the month. So that's rapidly approaching. We encourage any families that are interested to check out the information and find our contact information on the Community Asthma Program website on the Hasbro page.
All right, Barbara Jandasek with Hasbro Children's Hospital's community-based asthma programs. Thanks so much for joining us here at 4.
Thanks for having me.